So welcome back guys. Today in this session we will be talking about the RCH and the RMNCH+A. Yeah, so what is this? RCH means reproductive child health, right? And if you will go beyond this, then you will be finding RMNCH+A, that is the reproductive, maternal and child health, plus A for adolescents, right? So here we will be talking about several programs running by the government, right? And we'll try to understand them, right? So okay, let's begin with the RCH and RMNCH+A. If we talk about the RMNCH+A, right, basically it is a life package, guys, right? So RMNCH+A, it is a life package, right? It is a life package for the females especially. It is a life package for the females in India, right? RMNCH+A, if you talk about, guys, here A for adolescents, and mainly it will be focusing on the adolescents, right? So we'll be talking about that. However, in the RMNCH+A, if you talk about the interventions, right? If you talk about the interventions, we are having the 5x5 matrix algorithm which is working in the RMNCH+A. I mean that 5x5 matrix program is there. What is 5x5? We are having 5 sections into which 5 important points are there which we need to figure out, right? For an example, here there is reproductive health, right? Then there is maternal health, newborn health, right? So RMNCH, reproductive health. So RMNCH. So how many components are there? 5 components are there. So R for reproductive, M for maternal health, N for newborn health, right? Or you might say the neonatal health or the newborn health. Then C for child health and A for the adolescent health, right? So RMNCH+A. So CH is child health and then plus A is for the adolescent. That is also important, right? Then if you talk about these sections, then we are having the 5 important points as well. For example, R for reproductive health. So reproductive health is having the 5 important points in this. For example, here we shall see that there is a spacing, right? There should be the spacing methods. For example, postpartum intrauterine contraceptive devices might be used. Spacing between the birth of the child, right? It's not that every year they are giving the birth to the child, right? There should be proper education about that, proper education about the sex education, and all of these things should be happen in the community, right? So that we shall prevent this, and we are having the several programs for that, and ASHA is doing that for these kind of things, right? So proper spacing should be there. Then the interval IUCD should be introduced over there, HDC and the ESB, right? Then PTK, that is a pregnancy testing kit, right? Basically from the government side they are providing the NISCHECK kit, right? That is a pregnancy testing kit. We have already talked about that in some module. Sterilization services are also included in this one, right? If you talk about the maternal health, then we are having the MCTH which shall be used over there. Then high risk pregnancies, right? High trained HR, review maternal and the infant death, right? And identify the institutional delivery areas where the institutional delivery areas are present. We need to identify them, right? That is about the maternal health. Newborn health, basically the chances of coming these points are very less in the exams. Basically it's just to sensitize you that we are having the 5 points in the each particular section, right? In the newborn health we are having the exclusive feeding, HBNC through the ASHA, with the help of ASHA, essential newborn care, special newborn care units, we shall be talking about them further, and use of gentamicin by the ANM to prevent the infection and all. Child health, focus on nutrition part, diarrhea part, the management of the pneumonia, right? Then the full immunization coverage, we need to talk about that, right? And then RBSK, right? We talk about the RBSK separately. Adolescent health, if we talk about, then the teenage pregnancy, peer educators, strengthen ARSH clinics, we will talk about the ARSH clinics, right? Iron Plus initiative, right? Iron Plus initiative, and about the folic acid initiative, and the promote the menstrual hygiene, right? So these are the important points as far as adolescent health is concerned, right? Then we shall talk about a very important program, that is the Janani Suraksha Yojana, right? So you can see the symbol over here, Janani Suraksha Yojana. So right, Janani means again the Ma, right? That is the mother. So you can say the mother protection Yojana over here, Janani Suraksha Yojana, right? So this is a safe motherhood practice, right? This is a safe motherhood intervention, right? Under the NRHM, that is the National Rural Health Mission, which is coming under the National Health Mission, right? So there were 2 missions, National Rural Health Mission, then they introduced the National Urban Health Mission, and they just merge it together, National Rural Health Mission and the National Urban Health Mission, and they called this under the category of National Health Mission, right? And National Urban Health Mission was introduced in the 2014, and at that point of time they have merged it under the National Health Mission program, right? Okay, so here they have implemented this particular Janani Suraksha Yojana. It is about the incentive to the mother basically, which shall be given accordingly, right? So Yojana was launched on 12th of April 2005 by the Honorable Prime Minister, right? So here they are providing the benefits in the form of incentives, right? Now what intensives we shall be talking about over here from the government side, they will be provided to the mother or to the family, right? So here they are saying that only institutional delivery. They want to promote the institutional delivery. They don't want to continue the home-based delivery and all, because the chances of mortality, maternal mortality and the infant mortality rates are pretty high in cases of home-based delivery, right? So they want to promote the institutional delivery. They should be going to the hospital, and then they, right, the delivery should be happening in the institutional basically. It shall be the district hospital, it shall be the CHC, it shall be the sub-district hospital, it shall be the hospital, right? So that they are having the enough equipments to handle the pregnancy complications as well, right? So rural area over here, they will be getting around the women of rural area, right? They shall be getting the 1400 rupees, and urban area women, right? Rural area women shall be getting the 1400, urban area women they shall be getting the 1000 rupees as incentive, right? So rural area ASHA will also be getting the incentive for that. Why the ASHA is getting the incentive over here? Because ASHA, that's how the ASHA will be motivating the persons, motivating the families for the institutional delivery, right? So if the ASHA will be getting the incentive, she will be also having the motivation to motivate other families in the community that they should be going to the institution, they should be going to the hospital for the delivery purpose, right? Not the home-based delivery, right? Okay. So we shall see over here, 600 for the first 2 deliveries, this she shall be getting, ASHA worker. Then 400 per delivery after the 3rd delivery, right? 200 rupees after the 4th delivery, and obviously 5th delivery they will not be getting anything, right? Okay, so how many children's the government is actually expecting from one family? Only 2, not more than 2, right? Maximum 2 children are expected. Okay, so urban area ASHA will be getting the 200 rupees for that. Okay, so comparatively rural ASHA will be getting the higher price, right? So all are account pay check only. Okay, no cash over here. Okay, fine. So now once we have talked about the Janani Suraksha Yojana, that is about the incentive to the ASHA as well as the mother, right, or the family, right? Okay, once we have talked about that, now we shall be talking about the next scheme over here, that is the Janani Shishu Suraksha Karyakram, right? JSSK over here, and this is the symbol of JSSK where the mother is holding the baby in this manner, right? So this is the JSSK. What is the JSSK? Again, it is coming under the National Health Mission only, NHM. NHM is a very big program which is controlling so many things are happening under the NHM program, right? So Happy Mother's Day are actually celebrated on the 13th of May. What about the Janani Suraksha Shishu Karyakram program? Here they are talking about the safe and healthy motherhood, right? So here, we are talking about the maternal and the child health over here. Maternal health we are basically talking about in this particular moment. So over here we shall see that they are providing the cashless delivery, right? So both normal and the C-section cashless delivery is provided. Drugs and the diagnostics will be they are provided. So here basically all of these things will be provided free of cost, right? So they will be taking the mother from the hospital, from the door of the house, right? They'll be taking them to the hospital. Everything inside the hospital, whatever things, right? For example, about the delivery, is it vaginal delivery or is it cesarean section delivery? If some complication is there about the vaginal delivery, the doctor might opt for the cesarean section delivery. This delivery will also be free over there. Whatever diet will be provided to the female, right, it shall be provided free of cost, right? Whatever the instruments they are using, it shall be provided free of cost. So they will not be needing anything over there. It is a cashless delivery, right? So they are not asking for anything. So why they are doing so? Because they want to promote the institutional deliveries again, right? So that the families and the females will be will be feeling much comfortable going to the institution for the delivery purpose, because they don't have to pay anything for that. So over here we are seeing that cashless delivery, both normal C-section, whatever diagnostic will be happening, whatever treatment will be given to the female over there, that will be free of cost. So drugs and deliveries, that will be free of cost. Diet over here for 3 days during the normal delivery and 7 days for the C-section will be free of cost from the government side. Then the blood, if it is required, if it is anemia, right, if there was PPH and then blood was required, that is also free of cost provided. Transportation from the home to the health institution, that is also free, and transportation between the facilities in case of referral, that is also free of cost. For example, they came to one hospital and they said that no, you have to go to the tertiary care hospital for this particular complication. Then the referral also, that will be, transportation charge will not be taken from the family or the female, that will also be free of cost from the government side. And from the institution, when she will be discharged, and right, when she will be discharged, she don't need to pay anything for any kind of thing. They will be the ambulance will be picking them from the hospital and they will be dropping them to their houses. That is also free of cost, right? So everything will be free over here, from the door of the house to the institution. Whatever things will be happening in the institution, drugs, delivery charges, instrumentation charges, diet charges, anything, pharmacy related charges, diagnostic charges, blood product charges, anything will not be charged from the mother side, right? Everything will be free of cost in this particular Janani Shishu Suraksha Karyakram, right? So that is to promote the deliveries inside the institution, so that we shall be reducing the maternal mortality rates and the infant mortality rates, right, over there, and we shall be reducing the chances of PPH as well, because that can be managed very well in the hospitals or the institutions, right, obviously. Okay, now once we talked about that, now we shall be talking about the next one, that is the home based new care, right? So once we talked about the reproductive health, right, we have talked about two very important programs over here. One was the Janani Suraksha Yojana and other one was the Janani Shishu Suraksha Karyakram, right? So once we have talked about them, these are all about incentive. First was about the incentive, second was about the free services which are provided to the female, right, so that they feel more comfortable for the institutional deliveries, right? Once we have talked about that, guys, now we shall be talking about the home based newborn care. Home based newborn care. Now take this thing like a story over here, for an example, then it will be becoming so easy for you to understand this. For an example, firstly, what happened? The female should be opting for the institution delivery, right? The ASHA did her job well, and ASHA make them understand that it is it will be very convenient. You don't need to pay anything from your side. The ambulance will be coming to your door only, and they will be taking you to the institution. You don't need to pay anything over there, and all of these things. Many of the complication can be prevented over there very easily, right? So all of these things ASHA will be make them understand. Then if they will be opting for the institution delivery, then obviously once they will be going to the hospital, ASHA will be getting the incentive, and the female will also be getting the incentive according to the Janani Suraksha Yojana. And then under the Janani Shishu Suraksha Karyakram, they will be getting everything free over there. And at last, let's say after 7 to 8 days, if they will be discharged home well with their child, they shall be going back to their home under this Janani Suraksha Shishu Karyakram, right? So till now they don't need to pay anything over here, right? I'm talking about those females who are not able to going to the private hospital. Obviously it is about the government hospital, right? Now then comes the care of the newborn. Now because the family came back to the home with their newborn, right, with their child, so now we need to, as a government, right, we need to think about the newborn care as well. So newborn care should be provided as well over here, because we know that maternal mortality and the infant mortality rates are pretty high, right, if we will not be providing the better care to them, right? So over here we shall be talking about the home based new care. So what we shall expect over here in the home based new care, basically the ASHA will be going to the home, right? ASHA will be visiting their homes, and she will be checking over the newborn over there, that is everything fine, or they might be needing they might be needing some special care from the hospital side, okay, or they might be need the visit of the any kind of doctor over there, right? So ASHA will be going to their home, right, and she will be having the visits over there, right, and accordingly they can decide. So over here, home based new care, what we shall talk about over here. So what is the objective according to this? What is the objective in this home based new care, right? Objective is that ASHA promotes the breastfeeding. We know that what is the importance of breastfeeding in the newborn, right? Exclusive breastfeeding should be happening during the initial 6 months, right? So ASHA will be promoting ASHA promotes the breastfeeding. ASHA promotes the breastfeeding, right? ASHA will be promoting the health care, okay, and she will be checking over the body weight of the newborn, body weight measurement of the newborn, right? That whether the baby is growing according to the growth chart and all, right? Okay. Now, if the child is alive till what period of time? If the child is alive till the 42 days, right? Then ASHA worker has done really a good job over there, because that is the time period where the chances of the mortality of the newborn is very high. In the neonatal period, the chances of the newborn getting expiry is pretty high because of infections and because a lot of respiratory infections and all of other things, right? So if the 42 days period will be gone, then the child is coming out of danger zone, I would say. So over here, if the child is alive till the 42 days, then ASHA will be getting the incentive for that. Now, why the ASHA is getting the incentive over here? Because ASHA gave the visits, right? ASHA gave the visits, ASHA promotes the breastfeeding, ASHA was checking over the body weight and all, and ASHA, due to the visits of the ASHA, right, the child has survived till 42 days. So probably the child or this particular infant will be surviving for later period as well, right? Because now the child is out of danger zone probably, right? So that's why the ASHA will be getting the incentive for that, right? So I am saying that if child is active, I would say if child is alive till 42 days, right, then the ASHA worker, ASHA will be getting rupee 250 per child. On what day? On 43rd day? No, on 45th day. On 45th day, she will be getting, ASHA worker will be getting the 250 rupees per child, right? For more details about the ASHA worker, guys, I have already talked about that in the Indian healthcare system, right? You shall refer to that chapter for much detail about the ASHA worker, right? That ASHA worker will be handling one village. In the one village, we are talking about the 1000 population, right? So ASHA worker will be having the responsibility of the 1000 people in the in the community, right, in the village. So basically all those things I have talked about that in detail in that particular section. You shall refer to that particular section for the detail of ASHA worker, right? Okay. And what is the criteria, what is the eligibility criteria for getting the post of ASHA worker, what should be the qualification, educational qualification, and all of those things we have talked about that in detail, right? Okay guys, so that was about the home-based newborn care. Now if the delivery, right, home-based new care, what could be the permutations over here, right? Combination permutation over here. For example, if there is normal delivery, if there was normal vaginal delivery, right, normal vaginal delivery in the institution itself, right, in the hospital itself, then they might be asking you how many how many visits the ASHA worker will be giving to this particular under this particular home-based newborn care, right? So she will be providing the visits. How many total visits? She will be providing the 6 visits over there, right? And how she will be providing the 6 visits over here? She will be going to their homes day 3, right? Then day 7, then 14, then 21, 28 and 42, right? You just need to remember the table of 7 over here. Just before the 7, you just need to put 3. So 3, 7, 14, 21, 28, 42. These are the days where the ASHA worker will be visiting their home and will be checking upon the newborn, right? And will be checking that if the newborn is fine or the newborn needs some attention of the doctor. Okay guys, now let's say if the delivery was C-section in the hospital, if the delivery was C-section due to any kind of complication, right, it can be any complication over there, and let's say there was C-section, then in that case the visits are not increasing, rather the visits are decreasing, because the female will be residing in the hospital for a longer period of time, right? So post-operative period will be longer because she was actually had the C-section. So after the normal vaginal delivery, comparatively the females are discharged much earlier as compared to the C-section females, right? So over there we shall be saying that here the visits are decreasing instead. So 5 visits we are talking about, right? Here the day 3 visit has been excluded. So here only the table of 7 you need to remember. So day 7, day 14, day 21, day 28 and day 42, and that's all. Right, that is about the C-section visits, right? Now let's say that it was not the institutional delivery, right? It was not the institutional delivery due to some reasons. They couldn't go to the hospital and it was the home-based delivery by DAI or something like that. So in those cases, let's say, so this was the first scenario, this was the second scenario, and third scenario, it was home-based delivery, right? It was home-based delivery. So obviously they needs better attention, they needs much attention. So now the visits will be increasing or decreasing by the ASHA worker. The ASHA worker should be visiting more. This kind of child needs more attention over here, right? So now the visits will be increasing. So as compared to the normal delivery, one visit will be increasing over here. In the normal delivery, I told you 6 visits. Now here I am telling you 7 visits. Here I am telling you how many visits, guys? 7 visits. Now can we tell you which day she will be visiting? I told you in the normal delivery, first day was day 3. Now here I am introducing day 1. After day 1, it will be same like normal vaginal delivery. Day 3, then table of 7. 7, 14, 21, 28, 42. So how many visits are there? 1, 3, 7, 14, 21, 28, 42. There are 7 visits, right? Very, very important, guys. In the MCQs, they are very frequently asking you that in the normal delivery, how many visits the ASHA worker will be giving, how many visits for the C-section delivery, and how many visits for the home-based delivery. Any question might be asked, right? So here we shall remember accordingly, right? So 6, 5, 7, I told you about the normal delivery, C-section delivery, and the home-based delivery respectively. Now we shall be moving on to one more thing. Now let's say the ASHA worker was successful in her visits, and now the baby has overcome this particular period of 42 days. On the 45th day, ASHA got the incentive of 250 rupees from the government of India side. Very well. Now this newborn will be, will be developing further, and now this newborn will be becoming a young child, right? Newborn will be becoming a young child now. So now this young child also needs the attention that is everything fine? Is the baby is getting some kind of problem or respiratory problem or some other kind of problem, right? Now the ASHA worker will be visiting the home again, right? ASHA worker will be visiting the home again. So this is coming under, this is coming under home-based. I told you home-based newborn care. That was a newborn care. Now newborn has been developed into the young child. So home-based young child care, right? So home-based care for young child. Home-based care for young child, right? Or we shall say this as HBYC, right? So let's understand, guys, very easy over here. Once we have understood the home-based new care, now it will be easy for us to understand what is the HBYC, right? So let's understand HBYC, what is this? So here, this is a new program and it is launched in few states in India. So it comparatively, it is a newer program, right? Which was introduced in few states, okay? Few states in India, right? Obviously, we are talking about India only, few states in India, right? So here it's a good program actually, because after the newborn care, if the ASHA worker will be visiting the young child also, then we shall be reducing the chances of infections, chances of many kind of diseases in the newborn, in the young child basically, that will be drastically decreasing, right? So over here, if we talk about the HBYC home-based care for the young child, right, it is a particularly newer program comparatively. Home-based newborn care is happening from a longer time, but home-based young care, if we talk about, it is a comparatively newer program, right? ASHA will be visiting what age group? ASHA visits children of what age group over here? ASHA will be visiting the children of age around 3 to 15 months over here, right? 3 to 15 months, right? That is important, and that has been asked, that 3 to 15 months is the age group which is covered under the home-based care for the young child, right? So now let's talk about the visits. How many visits she will be giving over here? So guys, she will be visiting 5 times. So she will be giving the 5 visits. ASHA worker will be giving the 5 visits over here, right? So 5 visits will be provided by the ASHA worker side. She will be visiting 5 times over here. And let's talk about the days also, guys. Let's talk about the day. Days will be very easy. You just need to remember the table of 3. So day 3rd will be there, then day 6th, yes, then day 9th, yes, then day 12th, and then day 15th month, isn't it? So I was talking about I was talking about 3 months to 15 months, right? So that's how the months are covered: 3, 6, 9, 12, 15. Very, very easy. For the newborn care, you just need to remember the table of 7, and here you just need to remember the table of 3. Very, very easy, guys. You just need to remember this, okay? Very, very high yield. So 5 visits has been asked number of times. Okay, that is about the HBYC. Okay, and now again in the ASHA worker, she was getting the incentive at day 45th if the child is alive till 42 days, right? Remember home-based care for newborn child. Here also she will be getting the incentive, right? If she will be giving the visit over here, and over there, if the ASHA will be, overcoming the 15 months period. Now here the ASHA worker will again be getting the incentive, and this time how much will be the incentive? ASHA gets incentive. Will it be increasing or decreasing? ASHA gets incentive of rupees, same guys, same, that is 250 per child. So from one family, for one child, if she is giving the visits multiple times, I mean the proper visits depend on the method of delivery as well. So if she is giving the visits to the newborn child, and then after that to the young child, then she might be earning 500 rupees from one child, right? I mean from one time delivery, right? If she is working fine for that, right? And obviously by the Janani Suraksha Yojana, she might be getting the incentive if she is actually promoting the institutional deliveries, right? So that's how the government is also motivating the ASHA workers to to work on their toes and providing the better healthcare, right? Okay guys, now we shall be talking about the next one, that is the facility based neonatal care, facility based newborn care, facility based neonatal care basically. So what is this facility based newborn care? That is the FBNC. Here we are talking about three particular units, right? So what are these? Here we are talking about the newborn care corner, right? Newborn care corner, NBCC. Then we are talking about the newborn special unit, right? Or newborn stabilization unit basically. And then we are talking about the special neonatal care unit, right? So this is the newborn care corner. This is the newborn stabilization unit, okay? And then we are having the special neonatal care unit, right? Now obviously depending on the severity of the health of the child, the child might be upgraded to the SNCU, that is the top, and might be degraded to the lower units as well. Now in the NBCC, aims, what is the aim to introduce this? So aim is simple, that we want to reduce the neonatal mortality, right? Because that is the time where the deaths are pretty high, right? If you talk about the infant mortality rate, most of the mortalities are happening in the neonatal period. So that's why we had to introduce this different levels of care in this, according to this particular program, that is a facility based newborn care. So here on the very basic level, we are having the newborn care corner. Here, immediately the newborn care is actually provided. Immediate newborn care we are providing by the help of stimulation, by the help of warmth, and the breastfeeding. As soon as possible, we are providing the breastfeeding. We are promoting the breastfeeding over there. Then if the child is having a bit of bad health, I would say, if the child is having pneumonia or having the child jaundice or something like that, okay, different kinds of problems might be there, hypothermia and all of these things, then we might shift the child to the newborn stabilization unit, right? So here sick child will be coming over here, sick and the low birth neonates child can be managed for the shorter period of time over here. We shall be giving the kangaroo mother care. We have already talked about that, KMC, right? We were talking about how the mother will be holding that, the baby will be in the frog position, and all of those things we have already talked about. Then warmth and the feeding support and the IV fluids and the oxygen provision might be given over there, right? So bit sick child will be coming to this particular unit, that is the newborn stabilization unit. So management of the neonatal jaundice might be done, prevention and management, early detection of the severe cases, and referral we shall be doing in this particular stage, right? So if the child is very sick, if the newborn is very sick here, if the neonate is very sick over here, then we shall be referring this patient to the SNCU, that is the special newborn care unit, and here we are providing the extra care. We are providing the extra care 24/7. The doctor will be present over there. 24/7 the nurses will be there, right? So that is the case. So here the monitors will be present over there to the bedside over there as far as the SNCUs are concerned, and there will be providing the better care, right? Or you shall be saying the best care. So extra care of all ill and the preterm neonates we are talking about, right? So extra care will be provided to the all ill and the preterm neonates. Let's say it was just before the 37 weeks or the extremely, I would say extremely preterm baby might be shifted to the SNCU because they are having a very low weight, right? So warmth and the KMC will be providing over there, IV fluids, oxygen, and the management of the neonatal jaundice will be giving. Emergency care, like we might be giving the CPAP and the surfactant for the respiratory distress syndrome, right? So all of these things we'll be talking about SNCU. And let's say the newborn will be stabilized after the care in the SNCU, then the baby might be degraded, right? We'll be checking the criteria and in the babies, and then we might be degrading it to the NBSU, that is the newborn stabilization unit, and then finally to the newborn care corner, and finally the baby might be discharged as well, right? So that is the case over here, so that we shall be reducing. So what is the aim over here, objective over here, that we want to reduce the neonatal mortality over here, right? Okay, very nice. Now we shall be moving to the next one, that is about the RBSK, that is the Rashtriya Bal Swasthya Karyakram, right? That is the RBSK, and this is the logo for the RBSK, which you need to remember, right? Pictorial memory, guys. So RBSK, Rashtriya Bal Swasthya Karyakram, right? This might be asked. Here we are talking about the 4 Ds. Here we are talking about 4 Ds over here, D, right? So 1D is for defects at birth, the birth defects. 1D is for the deficiencies, several kinds of deficiency. It might be vitamin A deficiency, vitamin D deficiency, right? It might be iodine deficiency, or several kinds of deficiencies we might be talking about, right? So, there could be the anemia, right? There could be the vitamin A deficiency, vitamin D deficiency. Due to the vitamin A deficiency, bite spots might be seen. Due to the vitamin D in the children, we are talking about the rickets, right? Then SAM can be seen, severe acute malnutrition, acute and chronic malnutrition can be there, and all of these things. Then the goiter can be there, all of these things, right? We are talking about all of these things under the Rashtriya Bal Swasthya Karyakram, right? Then with the other 1D, there is a childhood disease, right? Like skin conditions, otitis media, rheumatic heart disease, reactive airway disease. There are so many diseases like that. And developmental delays and disabilities. What you need to remember? You need to remember just 4 Ds, right? Birth defect, childhood defects, and the deficiencies, and the last one is the developmental delays and the disabilities, right? 4 Ds you need to remember as far as RBSK, Rashtriya Bal Swasthya Karyakram, is concerned, right? Okay. Now we shall be talking about one more program, guys, that is the RKSK, that is the Rashtriya Kishore, right? After the Bal means chota bacha, Bal means small baby, small child, right? And then this small child will be, growing further to the adolescent. Adolescent in Hindi is called as the Kishore. So that's how they are talking about the Rashtriya Kishore Swasthya Karyakram, right? Rashtriya means national, right? So national adolescent, Swasthya means health, right? Health, and Karyakram means program in Hindi. So it might be called as in Hindi, if you talk about, it is National Adolescent Health Program. National Adolescent Health Program will be just the translation of this program. Otherwise, you just need to remember about the Rashtriya Kishore Swasthya Program. Kishore means K Kishore. Kishore means in Hindi, Kishore is called as male adolescent, and Kishori is called as the female adolescent, right? For those people who are understanding in English, right? Otherwise, who are comfortable with Hindi, they are understanding this better, right? So Rashtriya Kishore means adolescent, just remember that, okay? Fine. So here we are talking about the program, that is the RKSK, that is the Rashtriya Kishore Swasthya Karyakram over here, guys, right? Here in this Karyakram, we are talking about the adolescent, right? So here the targets are adolescents. The targets are adolescent because we are talking about the K is Kishore. Over here K is Kishore, right? So that is the adolescent, right? The targets are adolescents over here, which you are talking about. That might be your MCQ. And which adolescent we are talking about? What is the age group in the adolescent? You might have studied this in the pediatrics as well. Yes, that is about 10 to 19 years, guys. If the adolescent I am talking about the age group between 10 to 19 years, right? Here, we might be talking about the Sathya scheme. Here we are talking about the Sathya scheme, that is the peer-to-peer approach, right? That is the peer-to-peer approach, peer-to-peer approach, right? So here usually, one adolescent is talking in a friendly manner with his or her friend only, right? Not to the parents. They tend to, hide their things with the parents and all, because parents might be, somewhere or other, they might be strict to them and all of these things, what they will say and all of these things might be there in the mind. So that's why they are much comfortable in telling their things, in telling their secrets and all of those things to their friends only. And obviously they will be making their friends in their friend circle will be the adolescent group only, right? So that's why it's a peer-to-peer approach. Basically, that is the Sathya scheme. That is the part of which scheme, that is a part of which Karyakram, that is the Rashtriya Kishore Swasthya Karyakram over here, right? Okay, now under this one, just remember this one also, that iron folic acid supplementation we were providing. Iron folic acid supplementation, however, we have studied that under the iron folic acid supplementation we were providing under the Anemia Mukt Bharat program, right? Under the Anemia Mukt Bharat program, AMBP is the Anemia Mukt Bharat program. I have told you over there itself iron folic acid supplementation, and told you about the deworming as well. You know, for the detailed purpose you shall be referring to that chapter. But over here iron folic acid supplementation also under the AMB scheme, that is also covered under the under this particular Rashtriya Kishore Swasthya Karyakram, because I told you that the 6 interventions, 6 institutional mechanisms and the 6 beneficiaries were there. 6 into 6 into 6 strategy I was talking about in the Anemia Mukt Bharat program, guys, if you guys remember. So over there I was talking about 6 beneficiaries, and one of the beneficiaries were adolescents as well, right? So there I told you that all the girls in the 10 to 19 years of age group and the boys who are going to the school, right, they are the beneficiaries for the Anemia Mukt Bharat program. So over here itself, that's why we have talked about the iron folic acid supplementation to the adolescents over here is covered under the RKSK Rashtriya Kishore Swasthya Karyakram, right?